Here on 5 News, we've been welcoming local doctors and medical professionals to discuss the COVID-19 pandemic. Today, we are joined by Dr. David Hunton. He is the clinic president with Mercy of Fort Smith. Doctor, thanks for your time this afternoon.
My pleasure.
We have gotten a lot of viewer questions throughout this pandemic, and one of them has been, should people continue to see their regular doctor for checkups during this crisis? And if so, what's the best way to do that?
Well, that's a great question to start off with, and the answer is yes. And I think early on, both our providers and our patients were a little bit afraid to come to the office or to see us. So seeing us now is going to be different as we go forward. And we're going to be doing different sorts of visits. The federal government has made it much easier and accelerated the process for electronic visits, virtual visits, phone visits. So you may get a call from the office that asks you to, would you be willing to do a virtual visit? And we're going to ask patients about doing that. And, you know, early on we saw clinic volumes drop down to about 25% of normal.
Wow.
As we tried to figure out how we could see folks. And it's very apparent that we could do this very effectively in that virtual platform. We've got technology folks available at each office to talk to our patients about how they can connect. And whether you're a patient of any of the health systems, there's going to be a platform for you to be able to access seeing your doctor with that virtual visit. So there'll still be a number of people that we need to see in the office, and we may direct you to a different office depending on what those symptoms might be. But the answer is yes, we want to keep seeing you. Other illnesses are not going to stop
Sure.
during this time. And I would point out that we're now up to seeing about somewhere between 60 and 70% of the people that we were seeing before. And again, that's not just seeing in person. That's counting virtual visits and e-visits and phone visits.
So things seem to be going back up, which is definitely good news.
Yeah, so if you've got something you need to see the doctor for, let them help you decide whether it's something you need to come to the office and be seen about.
Gotcha. I know elective procedures are something we've talked a lot about. If someone had an elective procedure postponed because of the COVID-19 risk, what are they supposed to do now?
Well, hang on. We're going to get to that right now. And early on, when it became apparent that there was going to be a crisis with this, hospitals across the United States began canceling elective surgeries. And they did that to preserve PPE and equipment and the supplies. So that doesn't mean that if you've got appendicitis, you're not going to get operated on. It doesn't mean if you've got a cancer operation, for example, that you won't be operated on. So essential procedures will continue to take place, although we've pushed back elective surgery. Initially, it was 2 weeks, and probably would be at least the 1st of May before elective procedures will be rescheduled. So if you were scheduled for one, I would expect for you to hear from your physician or your surgeon for rescheduling of that. Stay in touch with their office. If they're not staying in touch with you, give them a call, because we're going to have to ramp this back up once we get through this surge.
Sure. We've also got a number of questions about emergencies. Obviously, elective procedures are something that are scheduled. Emergencies are not. So for people that are worried about being around patients who have COVID-19, but they have an emergency and they need to go to the ER, what should they do?
Well, by all means, you need to come to the emergency room. And I will tell you this, we've done several things, and it's not unique to us at Mercy and Fort Smith. We've developed a forward triage area where you're actually going to be interviewed outside initially and determine whether you might be a person under suspicion for COVID or not. If you are, or it's highly suspected that you've got COVID, you're going to go to a separate area that's been developed outside the emergency room. It's now inside. This has been constructed within the last couple of weeks. But then if you're not suspicious for COVID or a person under suspicion, you'll go to the regular part of the emergency room. So they'll be cohorted into those different groups. So one of the keys here is keeping the potentially COVID patients from the non. Those essential operations will go on. I will tell you, I feel better about going into the hospital than I do around town, honestly, because the coworkers are all screened, the doctors are all being screened, terminal cleaning's being done, and this and that. So, where the COVID patients are. There are not very many right now. We've been very fortunate both here and in Northwest Arkansas with regards to that. But we know where those are. They're separated from the rest. so that we can minimize PPE consumption. And you should come to the hospital. If you've got something that you would normally come for, you need to come.
That's definitely good to hear. Speaking of PPE, just quickly, is there enough? Do the doctors and nurses working for Mercy have enough PPE?
I believe we do. We've adopted a good policy with regards to usage and criteria and protocols for using our PPE at the same time conserving it. We don't just have enough to be careless with what we're using.
Sure.
So we're reusing masks, and the ministry's actually developing a procedure to reuse, particularly the N95 mask that you hear so much about for those high-risk situations where there's aerosolization of the viral particles. So very important that we're careful on what we use and that we conserve what we use. But yes, I think we're well prepared for that.
Good to hear. We'll have more questions for you coming up after this short break. Here on 5 News, we've been welcoming local doctors and medical professionals to discuss the COVID-19 pandemic. This afternoon, we're joined by Dr. David Hunton. He is the clinic Smith. Doctor, we have a number of your questions we want to get to you now. The first one is coming into this holiday weekend. People are asking, they have large families. They want to get together for Easter. Is this a good idea?
Absolutely not. And this is hard because all of us are used to doing special things on Easter and holidays like this, but it is really critical, unless you've been sheltered in place with your own family, you don't know what everybody else has been doing in the other contexts that they've had. So I know those of you that have followed stories on the news are familiar with some of the large family gatherings that have taken place in other parts of the country, and there have been multiple deaths in some of those families that got together. The problem is that many people have minimal symptoms with this illness, as well as another significantly large group that may be passing the virus on even when they're asymptomatic. So it's really critical that if you're with a group in your family, unless you've been in place with them in quarantine, basically, that you keep social distancing at the forefront, that you stay 6 feet apart, and that you minimize sharing food and things like that. It's just really important to avoid contaminating potentially one of your loved ones and infecting them.
And thankfully, we live in a time where we have technology, right? And we can use FaceTime and other methods to still connect with people.
Exactly, just like the visit we're having here now.
Right. I know that people, if they're out and about and they have gone out for those essential needs, you're seeing people like at places like grocery stores, for instance, wearing face masks and wearing gloves. Do these things really work to protect us?
Well, I don't think you can say that they totally protect you. And mask, of course, it's been recommended that folks wear a cloth mask when they're out and about. And I think in general that's a good idea. That does provide some screening of particles. In surgery for years, we've always worn masks as much to protect the patient as it was to protect ourselves. But very clear that different masks have different filtering capabilities, all the way from the N95, which is very effective, down to cloth masks. But I think wearing a cloth mask in public is very important. If you have other masks, that's okay as well. It for one thing, creates at least some psychological feeling that I've got some protection, and I think that makes people a little bit easier. But at the same time, perhaps the more important issue on this is sending a message to our fellow Arkansans that I'm taking precautions here. I'm trying to protect you from me, and I expect the thing from you. And I think it reminds us to keep from touching our hands to our face,
sure.
As well as keeping that social distancing in place. So I think that's a good thing. Gloves. I've read good things about gloves. I've read bad things about gloves. I don't think gloves replace washing hands and using hand sanitizers if you've been to the store when you're taking groceries out and whatnot. I'm leaving them in a separate room for a day before I take them out, unless they're perishables, in which case I'm wiping them down.
Good advice there. I don't know if we've heard that before, so that's definitely good advice. Thank you for that. We'll have a few more questions for you and your final thoughts after this break.